Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. My email is sreeklpm@gmail.com. We are continuing with the series of lectures of Prime Neurology. There are going to be 50 episodes of Prime Neurology, and if one listens to all these 50 episodes of Prime Neurology, one would have acquired a good knowledge of neurology. Right now we are on 31st episode of Prime Neurology. Prime Neurology Part 31, Parkinson's disease Part 3, Parkinson's plus syndromes. So in this episode we are going to discuss Parkinson's plus syndromes. First, what is Parkinson's disease? Parkinson's disease is due to degeneration of neurons in the dopaminergic nigrostriatal pathway. It is the second most common movement disorder behind essential tremor, affecting about 1% of the population over the age of 50. Clinically, Parkinson's disease is characterized by tetrad of TRAP, T-R-A-P, tremor, rigidity, akinesia, postural disturbances. Atypical Parkinsonism. Atypical Parkinsonism refers to a group of neurodegenerative conditions that are usually associated with more widespread pathology than found in Parkinson's disease. Example, degeneration of striatum, globus pallidum, cerebellum, brainstem as well as substantia nigra compacta. These conditions include multiple system atrophy, MSA, progressive supranuclear palsy, PSP, Cortico basal syndrome, CBS. As a group, they tend to present with Parkinsonism, that is rigidity and bradykinesia, but manifest clinical differences from Parkinson's disease, reflecting their more widespread pathology. Now let's check out what these are. So Parkinson's plus syndrome include features of Parkinson's disease with additional features, often symmetrical onset, lack of or irregular resting tremor, reduced response to dopaminergic drugs, often more rapidly progressive. Multiple system atrophy, they may have autonomic dysfunction, ataxia. Progressive supranuclear palsy may have supranuclear ophthalmoplegia, neck dystonia, pseudobulbar palsy, frequent falls, imbalance and difficulty walking, behavioral and cognitive impairment. Cortico basal degeneration, they have alien hand syndrome, apraxia and aphasia. So what are the prime differences between Parkinson's disease and atypical Parkinsonism? Atypical Parkinsonism and approach. In Parkinson's disease, there is uninvolvement of speech. So uncommon involvement of speech, presence of resting tremor, motor asymmetry, good response to levodopa, less aggressive clinical course. Whereas in atypical Parkinsonism, there will be early involvement of speech and gait, absence of resting tremor, lack of motor asymmetry, poor or no response to levodopa and more aggressive clinical course. Multiple system atrophy, MSA. Multiple system atrophy manifests as a combination of the atypical Parkinsonian features as well as cerebellar and autonomic features. Clinical syndromes can be divided into a predominantly Parkinsonian MSAP or cerebellar MSAC. Clinically, MSA is suspected when a patient presents with features of atypical Parkinsonism in conjunction with cerebellar signs or prominent autonomic dysfunction, usually orthostatic hypotension. Hot cross bun sign is an important MRI finding. What is hot cross bun sign? In the cerebellar form, a hot cross bun sign has been emphasized on MRI. It reflects atrophy of the pontocerebellar fibers that manifest high T2 signal intensity in an atrophic pons. So multiple system atrophy or Scheidegger syndrome divided into three types: MSAP Parkinsonism, MSAC cerebellar, MSAA autonomic. So the diagnostic criteria for MSA, a sporadic progressive adult, more than 30 years onset, Disease characterized by autonomic failure involving urinary incontinence, inability to control the release of urine from the bladder with erectile dysfunction in males, or an orthostatic decrease in blood pressure within 3 minutes of standing by at least 30 millimeters mercury systolic or 15 millimeters diastolic, and poorly levodopa responsive Parkinsonism, bradykinesia with rigidity, tremor or postural instability, or a cerebellar syndrome, gait ataxia with cerebellar dysarthria, limb ataxia or cerebellar oculomotor dysfunction. So this is the hot cross bun sign. So we can see here in T2 hyperintensity forms a cross on the axial images through the pons, representing selective degeneration of the pontocerebellar tracts. Progressive supranuclear palsy or PSP. PSP is a form of atypical Parkinsonism that is characterized by Parkinsonism with restricted vertical eye movements, particularly impairment of downward gaze. Patients experience hyperextension of the neck with early gait disturbances and falls. There is particular difficulty walking downstairs because of the combination of the retrocollis and impaired down gaze. In later stages, speech and swallowing difficulty and cognitive impairment may become evident. So these are the clinical hallmarks of the progressive supranuclear palsy. There is prominent axial rigidity and retrocolic posture, early stiffness and falls, worried face, slow vertical saccades, supranuclear vertical gaze palsy. The pathological hallmarks are the tau protein. So they can have hummingbird sign. What is tau protein? Globose neurofibrillary tangles. PSP, hummingbird sign. MRI may reveal a characteristic atrophy of the midbrain with relative preservation of the pons. Applause sign is an inability to stop clapping after being asked to clap and is a non-specific sign of frontal lobe dysfunction. Cortico-basal syndromes. Cortico-basal syndromes usually presents with asymmetric dystonic contractions and clumsiness of one hand coupled with cortical sensory disturbances manifest as apraxia, agnosia or alien limb phenomenon. What is alien limb phenomenon? Where the limb assumes a position in space without the patient being aware of its location or recognizing that the limb belongs to them. Dementia with Lewy bodies. Dementia with Lewy bodies is an early onset, rapidly progressive dementia that is part of the spectrum of Parkinson's disease. It is the second most common form of neurodegenerative dementia after Alzheimer's disease. The clinical criteria for DLB in addition to early dementia include Parkinsonism that is coincident with or follows dementia onset, fluctuating cognition, visual hallucination, REM sleep behavior disorder, neuroleptic sensitivity. So these are the synucleopathies and taupathies. The synucleopathies include MSA, PD and dementia with Lewy body disease, and taupathies include Alzheimer's disease, PSP and CBD. The red flags, the features predictive of atypical Parkinsonism: rapid disease progression, early gait instability and falls, absence or paucity of tremor, irregularly jerky tremors or myoclonus, poor or absent response to levodopa. The additional features of atypical Parkinsonism: abnormal eye movements indicates PSP, progressive supranuclear palsy; pyramidal tract or cerebellar signs indicates MSA; dysautonomia indicates MSA; severe dysarthria, dysphonia or stridor indicates MSA; apraxia, alien limb, myoclonus indicates corticobasal syndrome; early prominent dementia, dementia with Lewy bodies, progressive supranuclear palsy or corticobasal syndrome. So these are the wonderful concepts of Parkinson's plus syndrome. I hope you have enjoyed listening to this wonderful concepts of Parkinson's plus syndrome. The other exam-oriented clinical neurology concepts, the clinical neurology concepts I put in a book called Exam-Oriented Clinical Neurology, written by me, Dr.Sreenivas, published by White Army Publications. If interested, this book could be purchased. This book will be useful for students appearing for clinical neurology exams. The other book I have written is Focused Neurology, written by me, Dr. Sreenivas, published by CBS Publishers and Distributors. This includes all the theoretical aspects of neurology, put it in a question-answer format. This book will be very useful for students appearing for orals or viva exams. This book is available online from all leading booksellers, including Amazon. So if interested, this book could be purchased online. I hope you have enjoyed listening to these wonderful concepts of Parkinson's plus syndromes. As I said earlier in my lecture, This contains a series of lectures of prime neurology. There are 50 episodes of prime neurology, and if one listens to all these 50 episodes of prime neurology, one would have acquired a good knowledge of neurology. We have just now finished another episode of prime neurology. If you have enjoyed it, please like and subscribe to my YouTube channel, Dr.Sreenivas Medical Concepts, which is India's leading neurology educational YouTube channel, and my web page, Dr. Sreenivas Concepts. Thank you. Bye.